From the JAMA Network, this is the JAMA Medical News Podcast, discussing timely topics in clinical medicine, biomedical sciences, public health, and health policy, featured in the medical news section of JAMA.
This is Rita Rubin from JAMA Medical News. Dr. Stephen Kornfeld joins us today from the National Quarantine Unit in Omaha, Nebraska, which has to be the most unusual location for a guest on any of our podcasts. Except for a couple of days, the quarantine unit has been his home away from home since he was repatriated on May 10th from aboard the Hantavirus-stricken MV Hondius. He's one of 16 passengers in the quarantine unit. 2 others were transferred to Emory University in Atlanta. You likely have heard that Dr. Kornfeld, a semi-retired oncologist from Bend, Oregon, stepped up to care for fellow passengers when the ship's physician became ill. And he's here to talk about that experience. Steve, thanks so much for being with us today.
It's a pleasure.
I gotta ask, how are you?
Well, physically, I'm doing great. I've had no symptoms. I'm getting a bit of daily exercise. It's a little challenging being holed up here, but things are going okay.
Do you get to talk to the other passengers or?
No, we're all in our own rooms. I communicate with the staff for a few seconds throughout the day. They're usually wearing a mask. The other passengers, we communicate by WhatsApp or a phone call.
Yeah, okay. And everybody's doing well.
As far as I know, everybody remains asymptomatic.
Great. Now, as I mentioned, for your first couple of days in the U.S., you were not in the quarantine unit. Where were you and why?
Well, I was in the biocontainment unit as an inpatient. This facility and that facility is part of the University of Nebraska Medical Center. And when I was on the boat, I had a sample taken on May 3rd from my nose, and it eventually made its way to the Netherlands, and it was read as potentially positive. And while that positive wasn't confirmed, it wasn't a negative. So I was listed as positive. And the early news said an American returning home with Hantavirus. Well, that was me.
Yeah.
So I was placed in the biocontainment unit with the assumption that I was a positive. I was still asymptomatic. And after a couple of days, when all my PCR tests returned negative and my antibodies returned negative, it was clear the previous positive was false. And I was now just an exposed passenger, and I'm now in the quarantine unit.
Great. I mean, I've read that you were ill on the ship in April, but it must not have been hantavirus, right? Because you don't have any antibodies for hantavirus.
Yeah, that's correct. It never felt like it would turn out to be hantavirus because of the timing. It was very early in the trip, but it was a reasonable thought, and it would have been great in a way if it was hantavirus. That would have meant that a number of us had hantavirus, were not that sick, recovered, and then potentially could be on our way.
Right, for sure. Well, were you and the other passengers aware that some people on board had fallen seriously ill? And if you were aware, I mean, did you assume they must have had COVID or maybe the flu?
Well, the original passenger got sick in early April and died on April 11th. It seemed like a one-off event, and things happen when you're on a boat for many, many weeks. The doctor on the boat felt it wasn't communicable, and that's what was relayed to us. So I think we all felt nothing to really worry about and just continue on with our travels.
Yeah, because it was just that one person who
Yes.
was sick at the time. Yeah. Well, how did you find out that the ship needed a passenger to fill in for the ailing physician crew member? I mean, by then there must have been more people sick.
Well, towards the end of April, the wife of the original passenger who had died, she ended up dying in Johannesburg, and another passenger was transferred off the boat on Ascension Island and ended up in Johannesburg. So we had 3 ill people, 2 of them married, And of course, everybody was beginning to ask, could this all be related? Every day we heard they do not have a diagnosis. They kept on testing him for all sorts of viral infections, and they all came back negative. The first day in May, I heard that another passenger was sick. And so I just almost innocently just went to one of the reception people and asked if I could talk to the doctor to see if he needed any help. And then I was told, well, maybe you should talk to the expedition leader. He said, well, it turns out the doctor's also sick. He fell sick earlier today, and he's no longer able to function as the doctor. So what started as just an innocent question quickly escalated into, I'm now the default medical person for the ship, which includes the sick passenger, the sick doctor, another crew member who became ill, and then for anybody else on the ship that could become ill or had other complaints.
Wow. I mean, there were other physicians among the passengers. So why were you the one who stepped up for the ship's physician?
Well, there were other MDs, but as the most internal medicine oriented, active practicing physician, it sort of fell to me.
So it sounds like the first person who died on the ship, you weren't acting as a physician for the passengers yet. Did you care for the other person who died?
Well, the lady who died in Johannesburg, she left the boat with the others at St. Helena, which was when a lot of people were going to leave. So she wasn't even a patient. Apparently, she was feeling a bit ill before she left. So I had no contact with her. The passenger who I saw on May 1st, she died the next day on May 2nd. And I did care for her in the last 24 hours.
Wow. I mean, what were some of the challenges of providing medical care on this ship? For example, did you have adequate personal protective equipment? And was there a nurse among the crew members?
There was not a nurse, but the staff were incredibly helpful. And one of the gentlemen on the staff, he sort of became my assistant. And while we didn't know about the first case of Hanta to May 2nd and the second case till May 4th, from the beginning, it was hard to ignore that multiple people were sick and we could be dealing with a contagious process. So from the beginning, I wore mask and gloves. Within a day, I was able to find better masks, more N95 style. Then I found some goggles and I found some aprons. So over about 24 hours, I was able to be a little bit more completely protected.
Well, Steve, how did you and the others on board learn that the serious illness that had infiltrated your ranks was Hantavirus? I mean, you must have been shocked.
Well, everybody was shocked. You know, if you just do a quick Google search on diseases that affect cruises, Hantavirus does not come up. You see norovirus and Legionella, and we were all thinking about those things. But we also knew that the gentleman in critical care in Johannesburg was being tested for everything that's normally tested for, and he was coming back negative. Every day we heard he's still in critical care and nobody knows what's wrong with him. So it was very challenging for us to try to second guess what could be going on when this gentleman is getting expert care and being seen by an ID physician. When we heard about his hantavirus diagnosis on May 2nd, nobody really thought that this was all hantavirus because most hantavirus is not person to person. It's rodent to person, and that's where it ends. And we thought maybe he came on the boat with hantavirus, separate, got sick, and everybody else had something else. It wasn't until the second passenger that was in Johannesburg who had passed away was diagnosed with hantavirus based on specimens that had been collected days before that it was clear this was a communicable hantavirus and it must be an Andes form. It took a few more days for that to be confirmed, but we had no question. And then it was clear to all of us, including the World Health Organization and the European CDC, that we were in the middle of a hantavirus contagion. Around May 2nd, when we heard, or maybe even the day before, people were beginning to worry about something. So more and more people were wearing masks. On May 4th, when the second Hanta was diagnosed, and we just assumed this was a clear communicable infection, then the boat went into lockdown.
How did you get your meals when that happened?
Well, lockdown on the boat was sort of like lockdown during COVID. We went to the dining room with our masks on. We took our masks off to eat, and then we put our masks on. When I became positive, or was told that I was positive, then I self-isolated. I stayed in my room for the last 3 days of the cruise, and I got my meals delivered to me, a tray left by the door, a knock, and then I'd open the door and grab the tray. But the rest continued to use the dining room. Fortunately, the cruise was only half full at that time, and so the dining room could be spaced out. A table of 4 had 2 people.
Because people had left the cruise, was it on that island?
They left in St. Helena.
Right, St. Helena. So they were already planning on leaving. That was not because of the Hantavirus or illness or whatever. That was just the end of their part of the cruise, right?
Yeah, that's, I think, been a little confusing, that the idea that maybe all these people left because they were worried. They left because their trip was over. It was a 2-part trip, and part 1 was over, so they left.
Yeah, got it. Now, the Centers for Disease Control and Prevention is saying that you and your fellow passengers will be able to leave the Nebraska quarantine unit on May 31st and complete your quarantine at home. Is that still, as far as you know, what's going to happen?
I hope so. Everybody in this unit is committed to a 40-day quarantine. Nobody's arguing with that. I think the debate is, where do we quarantine, here or at home? From the beginning, we've been told that home quarantine should be safe for the public. Hantavirus is communicable, but not as easily communicable as COVID or a lot of other diseases. A lot of us have home situations that are very conducive for home quarantine. And that's where I think a lot of us would like to complete the quarantine. When we started, we were told you could really leave at any time. And then a few days ago, they said, well, you can leave at any time after May 31st. So I'm hoping that remains, but things might change. I don't think our viral situation is going to change. Our exposures are our exposures, but things are still going on in the world around us. I think some other people getting ill from the boat may have been part of that decision. And what happens to other people from the boat going forward will probably play into that decision. I'm hopeful that nobody else will get sick for a lot of reasons. And I'm hopeful then the May 31st quarantine on-site date will hold and some of us can head home.
I guess a lot of things stand out to you about what happened on board this ship. But as far as you serving as a physician on this ship, is there anything you want to add that we haven't talked about that was surprising or especially memorable?
Well, a lot of the ship experience that last week is a bit of a blur. A lot of people talk about how heroic what I did was. I tend not to think of it that way. I stepped up. I think a lot of physicians would do that. I think the ship environment is a very unique environment. It's not created for critical care people. That's not what a ship physician or a ship's infirmary takes care of. So from the beginning, I realized how limited my supplies would be, or my ability to really take care of critically ill people. And that was an interesting dynamic inside of me. One, it was a little frustrating that I didn't have a lot of tools that might be available to me. But also, I realized that a lot of what was going to happen was a bit out of my control. And a lot of what I was there to do was to be a calming presence to the passengers, that they knew that there was a medical person on board, and to just help assess the 2 sick people on board after the other patient died. I was in constant communication with the World Health Organization, and just keeping an eye and monitoring people and helping work on their evacuation. So ultimately, high-level medicine wasn't being utilized. It was more kind of an emotional and social support.
Well, Steve, I can imagine that this cruise was a bucket list item for you. I mean, it was like a 33-day cruise?
Yes.
Yeah. And you're a birder? Was that why you wanted to take this cruise?
Well, that was the main draw. I mean, I like going to remote places. I like going to islands. There were birds and there were a lot of very unusual mammals. But to me, it was about the nature.
Yeah. Well, I have to ask, are you planning on boarding another ship anytime soon?
I would have no hesitation. This was a one-off, just crazy to comprehend situation.
Yeah. Well, the ship was lucky that you happened to be there, because I can imagine how you really helped keep people calm. So thank you so much for talking with us, Steve. I'm Rita Rubin, lead senior staff writer for JAMA Medical News, and I've been speaking with oncologist Dr. Stephen Kornfeld about his experience stepping in for the ailing ship's physician aboard the Hantavirus-stricken cruise ship. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com or search for JAMA Network wherever you get your podcasts. This episode was produced by Daniel Morrow at the JAMA Network. Thanks for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.